We're going deep down the rabbit hole, hunting for the world's most dangerous COVID conspiracies.
The pandemic was relied upon to usher in the New World Order.
And at this anti-mask rally in Toronto,
take your masks off.
These ideas are everywhere.
You think COVID is a hoax?
Yes, I do, 100%.
There's quite a few people. This crowd has grown. Clearly the message is, do not wear masks. They're anti-vaccine.
They kill children. They kill children.
They're against the government.
100% propaganda!
We need you, ma'am. We need you to be quiet, please. I've never experienced this type of vitriol.
Liars! Your kids will be next!
These types of attacks and this type of anger before.
All of these claims debunked repeatedly, yet they still thrive online.
This whole vaccine is going to be all risk, no benefit.
Close to 90% of Canadians have seen some kind of COVID misinformation.
Many people argue that this pandemic was a plandemic. A lot of it feels very planned to me.
So we're heading inside this growing movement to expose how they profit from their lies and exploit your fears.
That's a $495 course US. We think that's an absolute bargain.
But first, we know this kind of misinformation has been viewed close to 4 billion times, and many social media companies have made big promises to crack down during the pandemic. We're putting that to the test. We're poring over posts, looking for red flags. We team up with social media expert Imran Ahmed. He's the founder of the Center for Countering Digital Hate.
Facebook, Twitter, YouTube, and Instagram have become the primary super spreaders of misinformation in our world.
How bad is it?
They've created a second pandemic, this time a social one of misinformation that is taking lives just like the biological pandemic that is coronavirus.
And we see all kinds of claims, from 5G causes COVID,
false information,
I'm going to report this,
to the vaccine causes sterility.
Misinformation.
flag it.
Question is, will the big 4 companies actually take down these harmful posts when we report them?
Vaccines are inherently dangerous. Let's flag it.
While we continue the hunt... Hi, Tony.
Hello, how are you?
We meet Tony Green in Oklahoma. He got caught up in the COVID conspiracies.
Did you think COVID was a hoax?
It was definitely, it was overhyped, oversold to us. It's just like, this is not gonna affect me, this is not gonna be me.
Part of his skepticism came from seeing videos like this on social media.
Look at all the people here. Virginia Hospital Center, completely empty, cowards.
A false claim in the first wave. ERs were empty for many reasons. People were under lockdown, and some hospitals had designated areas for COVID patients.
I mean, there was just so much misinformation. It was just hard to really decipher what's what.
Feeling pretty safe, Green decides to host a family gathering back in June.
Did you follow any COVID protocols during that gathering?
No, nobody's having symptoms. Everybody seems to be okay. What good is a mask gonna do? What good is staying away and not hugging my mother really going to do?
Days later, 14 family members are infected with COVID, including Tony.
Profusely sweating, waking up in night sweats, constant drowsy dizziness, sleepy, fatigue, aching, radiating chills, and I ended up in the hospital. And there was a blood clot on the way to the brain, and the virus had attacked my nervous system.
His partner's grandmother and father die.
It feels a lot like maybe one might feel that got behind the car, drinking and driving, and took out a family.
Back on our COVID conspiracy search, we find Sherry Tenpenny.
We shut down the entire global economy over a flu virus.
One of the biggest COVID deniers around.
The amount of people that say that
The person that changed my life or saved my baby was Dr. Sherry Tenpenny.
A registered osteopath in the U.S. She's all over social media with hundreds of thousands of followers.
I'm kind of like the grandma of this movement.
And she sells all sorts of products, even runs an anti-vaccination university, charging about $600 Canadian for a training boot camp.
We're going to build an entire army to stand up and say, not only no, but hell no.
So one of our producers signs up.
Welcome, welcome.
To find out exactly what she's selling.
Practice them in front of a mirror. Get that down so you can say that like you could spell your name.
Close to 400 people register from around the world, including 18 physicians. They're here to study her methods and learn more about her theories on the COVID vaccine.
From the J&J shot, that injecting that protein that they do, that can cause cancer. This is a well-designed killing machine.
Sherry and her staff will bring in an estimated $250,000 Canadian from this boot camp. Creating doubt is apparently good business.
You can order zinc, vitamin D, whatever else you want from that site right there. If you spend $100, we get $10.
And one of Tenpenny's targets, the vaccine hesitant.
You're in our choir. It's the downside slope of that bell curve, that 25% of people that go, man, I know something's wrong. I just don't know what it is. Can you give me some information? How can I convince my family? My job is to teach the 400 of you in the class so that each one, all of you 400, each one of you go out and teach 1,000.
That's very concerning. It sounds like the rhetoric of a cult. Of converts. It's going to have an impact on public health. It's going to have an impact on vulnerable people who didn't sign up for this, but who may get sick as a result.
Colin Fernandez is an infection control epidemiologist. He specializes in information technology at the University of Toronto.
I don't know how many people she has persuaded, but my fear is that it could be a lot. So yes, I'm concerned.
3 themes emerge from this boot camp, and we've noticed them in our research too. First up, COVID isn't dangerous.
Take the entire global economy to its knees for a big fat nothing burger, which is what I've been saying from the very beginning.
COVID is dangerous. If everyone in the world got COVID, 50 million people would die. That is misinformation.
Second, COVID vaccines are harmful.
This is genocide, people.
We've now inoculated millions and millions of people worldwide. We have not seen a jump in mortality, so this claim is not true.
The third, governments conspired to create this pandemic.
It's a political agenda at the very top.
It's hard to find anything that governments around the world could possibly agree upon at all, let alone something that is so very disruptive to commerce, to trade, to peace and quiet, to prosperity. It doesn't make sense.
It's time for the Q&A at this boot camp. Our producer gets a question in.
Any advice on what's going on with these vaccine passports?
Vaccine passports are being considered in many countries, including Canada. It's digital proof that an individual has been vaccinated against COVID-19, primarily so they can travel.
I'm talking to a lot of people that are in the techie realm.
Matthew Hunt is Sherry's business partner.
In the background, this is what all the hacker-cracker folks that are really pissed about this are working on.
Oh, good.
And look at what Matthew says when we ask a follow-up question in the chat room.
And this was the exchange.
Wow.
Do you mean hackers will be able to give you green status without a vaccine? He says that's one of the hopes.
When someone says very clearly they're hoping to be able to hack a system to forge a credential, that's engaging in what looks like possibly a criminal conspiracy to put people at risk. This is pretty bad.
We reach out to Matthew Hunt. He tells us he's not involved, nor does he support the hacking of vaccine passports. As for Sherry Tenpenny, she doesn't want to come on camera, but says she stands behind the content in her course and makes no apologies for earning a living.
You want to give money to other vaccine companies that are only going to poison and actually hurt and actually kill other people?
This is one of Sherry's former students, Vladislav Soboleth.
This is a seed of doubt that we need to plant to the people.
My job and your job is to sow seeds.
He's the founder of Hugs Over Masks in Canada.
You know, the wave definitely spread all around the world, you know, all across the world in terms of Elon Musk influence. And I know you are an integral part of that.
And he's organized anti-mask rallies across the country.
You're not allowed to force them wearing masks. You endanger their health.
These masks cause issues with our lungs. It's causing lung cancer, all types of things.
Vladislav agrees to speak with us from Vancouver.
Why are you against mask wearing?
Because they're detrimental to the health, psychologically and physically.
It has been proven to stop or at least limit the spread of COVID. There is science to that fact.
Very questionable data. We never had the second wave. We never had the first wave.
Now this sounds familiar.
It's really hard to be fearful of a second wave when we really never had a first one.
Sherry and Vladislav believe COVID is no big deal.
The hospitals are empty. The ICUs are barely used.
We were in an ICU just a few months ago, and it was near capacity. Many of them were COVID cases.
The government can very easily manipulate the amount of positive cases they can have.
But if they're false positive, what would you say their illness is due to?
Flu, regular flu.
You don't think doctors can determine the difference between the flu and COVID?
A lot of those numbers been completely mislabeled.
If not for lockdown, if not for masks, if not for vaccines, then what? How do we get rid of COVID?
A real health advice that you don't hear from the experts is eat fruits and vegetables, take your vitamins.
That's something we've heard before.
How do we get rid of that virus?
Vitamin D, vitamin C, sunshine.
They take some C, D, and A, vitamin C, D, and A, and some herbal medicine and some homeopathy, and they're fine.
Next, testing the social media giants.
So they're profiting off the pandemic.
They're addicted to the revenue.
We're hunting for COVID conspiracy theories.
You know it's false.
It's false, yeah.
We report over 800 pieces of misinformation that haven't been flagged by Facebook, Instagram, Twitter, nor YouTube.
The scamdemic is a scam. Let's report it.
And the results are in. The tech giants only label or take down roughly 12% of the posts we report. Expert Imran Ahmed sums it up for us.
They said they're doing everything they can. We gave them 800 bits. They didn't take action against 700.
What does that tell you?
It tells me quite simply that they do not care.
And Imran has a theory why they're not taking action. His research estimates the movement is worth $1 billion to these corporations.
If we take just Facebook and Instagram, in the first 2 quarters of 2020, they doubled their profits.
So they're profiting off the pandemic.
They're addicted to the revenue that comes from the traffic generated by malignant, hate-filled, and often dangerous misinformation.
Facebook says it has a strict policy now, and it's led to the removal of 2 million posts in February alone. But the ones we flag, many are taken down only after we contact them. Same with YouTube. Both companies dispute some of our findings, arguing they don't breach their policies. Twitter wouldn't comment on our results, but they all say they're working harder than ever to crack down on misinformation.
But remember this? The vaccine causes sterility? It's still up. Tony Green now knows the truth. It's come with tragic consequences. He's signing off social media for good.
I just don't see the value in it anymore. I see it tearing people apart.
For more facts on COVID-19 and the vaccine, check out our website, cbc.ca/marketplace.